Hello again, welcome to the Global Reach podcast brought to you by the Global Reach Studios. And this is our episode 2. It's going to be a wonderful one. Episode 1 was awesome. We had Stephen Odefade, a lecturer from the University of Asa.
Professor.
A professor specifically. And today is going to be awesome. My name is Donald, and I have with me, as usual, in the studio, my best friend, Mamus. Over to you, Mamus.
Yes, thank you very much, Donat. Once again, you're welcome to the studio, the Global Studio. Today, I want to seize this single opportunity to introduce. I think it's a privilege tonight to introduce to the audience our guest. She is a professional registered nurse here.
Here in Finland, specifically.
She did her nursing degree from Novia University of Applied Science. Before then, she was in Nigeria. She did her VSc back in Nigeria from one of the prestigious universities back then. She had actually worked at different organizations back at home. When I say home, I mean Nigeria. She left Nigeria for many years now to Finland to study nursing. She graduated as a nurse. She's a practicing registered nurse here. Ladies and gentlemen, she's no other person but a politician here also in Finland. Join me, welcome, Mrs. Okorie Chineye.
Politician and registered politician and registered nurse.
Yes.
Yeah, yes. Talking about politics, I am trying to relate nursing, the healthcare sector, and politics. Why did you dabble into politics?
First of all, when I was in Nigeria,
Yes.
I never loved politics. And it's also surprising to me that I came to Finland and started to love it. At first, it was a woman that I love so much here in Finland who talked to me about it, and I told her, you know what, I'm not into politics. I don't love it. It's a dirty game and, and all whatnot. But then she tried to convince me, being that the party which she talked to me about is a Christian party. So I now, succumb to it.
Okay.
And then I said, okay, I'm going to go for it. And then the connection to nursing, I would say, when I now started reading everything about the politics in Finland, I found out that there was really like poor integration, especially in the healthcare system. It's a bit hidden, but it's just the discrimination and everything. So I'm like, if I could get into that place with my position now as a nurse, maybe I could talk things, that could make a good change in the political, sectors here. So that's why I held on to that and said, I'm going to
So beautiful.
take my behind the answer and was in politics. Yes, he's a politician
Only in Nigeria or
in Nigeria.
okay, and that would you say that's contributed to you finally accepting to go to politics?
No, he didn't at all. He didn't at all. Because actually for him, I also found his own, not like physically, but then I didn't want him to continue with it. But at some point, because I'm a Christian, so I got this direction or this leading in my spirit that if we're really like craving for change in Nigeria, and we are always saying where the righteous is on the trail, the people will rejoice, right? Now, when the righteous people, when the righteous people now come, and then maybe God is now demanding that the righteous should come from my family, should I now be sitting on it and projecting it?
That's true.
So I decided to let him do what he wants to do. Yeah.
Okay. Yes, thank you.
One more thing before we tap into health questions.
Yeah.
Why Finland? Why did you choose to come to Finland?
Marriage.
Okay. Oh, marriage.
Yeah.
Marriage. You
That means he was there.
He was here before me.
How your husband brought you here to feel.
So it was a must to go.
Is that why you chose to wear the slow cut? So that I mean, your hair when you were flying to Finland, you chose to.
Actually, I came to Finland with Grace.
Okay.
Yeah. I was very into
I
Finland. I had her.
I think you like unique kind of hairs. Or braids. Okay, that's good. All right, let's come back to the nitty gritty. Why we actually brought you here. The topic of today is just simple, related to your discipline, mental health, and burnout in nursing. In fact, we are actually looking at an immigrant perspective. All right. So we would like to ask this question. From your experience as an immigrant, how would you describe mental health and burnout in the nursing profession?
Mental health is something that, from my experience, if I will say, it's something of the mind, because if you set your mind that this is what you want to achieve and this is where you want to be, for me, I don't think it has so much effect to my mental health. In as much as in the working, sector, when we are at work, you're going to face a lot of things that can affect you mentally. But then because you have a target, you have a focus, right? So you, at the end of the day, you don't let those things, to weigh you down. You just drop it at work and then go your way. Guess the fact is that they will be there. Like so many things to weigh you down, to bring you to a zero level. But then it's just left for you to say, no, I want to push through with what I want to do. Yeah, so for me, I experienced those things, but I
Did it burn you out?
No. I don't let it burn me out.
Okay, so when you first started nursing and feel like, what surprised you most about the emotional demands of the job? Actually,
Okay. It's how
you can just go back memory lane.
yes, it's how they would for the patients, I will say, they will take you step by step with the treatment plan. Because I remember where I'm coming from, Nigeria, most of the time, okay, I was not a medical professional or in healthcare as of then. But then my first child I had in Nigeria. And those days, I remember when I go to the antenatal, I don't get answers to the questions I have. Most of it will be that, they will always say, Madam, just, this is not your business. Just take the medication. Whatever they are giving to you is fine. You just have to shut up and go with the flow. But then it's the other way around here in Finland.
So it was a pleasant shock.
Yeah, it was a pleasant shock for me. Yeah, so I found out that, like you have to go hand in hand with emotions for the treatment plan. They have to know every medication you're giving to them and, everything, like the whole treatment was serious.
Yes.
Yeah.
So, in the workplace, generally speaking, burnout is always factored by things like time and workload. And I know from should I say indirect experiences, because I've not worked in the health sector, but I have families who work in health, and I have two kids, and that so it means that I've gone for prenatal and postnatal visits,
You visited.
and I now talk to doctors back in Nigeria, and some of them in the public sector work 24 hours, even nurses. So they burn out. Sometimes the doctor who is talking to you is tired, is found out, is famished, but he just has to do his work. As some of them who are close to you, they will tell you, because you are wicked and they are losing that, they only give me 5 minutes. Just go to rest today. Because you have a good wrap off. So the burnout rate back then, I don't know how it is right now. I've just been there for maybe about 2 years. Was so high. I think it's still very high for doctors to be working almost 24 hours. And the nurses. How is it here in Finland?
Like I said, when your colleague asked me the first time about it, I said, I don't rule out the burnout. It's there.
Yeah.
It's really there. But then what I'm saying is that, like, it's all about loving what you do, right? It's about your interest. It's about your focus. It's about what you want to achieve at the end of the day. So the burnout is there because most times, even here, it's even starting to get worse at this particular period because the government are trying to save and save and save. So they are the staffing, they are cutting them. You come to a shift, it's just like 2 or 3 people there, and managed to, like, yes, compared to 5. Yeah. So, and sometimes it's gonna be also like new intakes. They don't have any experience. Yeah. So you're in between, teaching people what to do and also doing the job. So sometimes it gets, if I use that word, crazy at work. But then because this is just what you've signed in for, like, this is what you love to do.
Young passion for
So
it.
exactly. So at the end of the day, you go home feeling like nothing has just happened.
Which means that for someone, there's a possibility that some people are nurses or in the health sector, they don't actually have passion for it, or it's something that they happen to venture
Exactly.
So those ones would experience more burnout and have more mental well-being.
Exactly. And that's why you also find some of them that at the end of the day, they quit.
They quit.
Yeah. I've had 2 colleagues that had to change profession.
Oh, wow.
Yes.
I think I know one of them. I'm not very sure.
So they had to change because they're like, it's so much. They couldn't handle it.
Yeah, but one more question. I know you have
Someone's glad.
regarding this passion. I have a friend. He's Finn.
Okay.
So he's a friend of his who is also Finn. He's a doctor. I will not mention the specific area.
Okay.
He's one of those doctors. But he went into that profession not because he wanted to. I think it was more like, mind as a young boy growing up, you have to, maybe parents were telling me medicine, and going to this area. And he got into it. He did well in his school base, graduated, became a doctor, a sound one. But after working for some years, a good number of years, more than 10 years, I think he retired from full-time work.
Okay.
And then started to work on part-time. They call it when they need him. And sometimes he tells them he's busy, whereas he's not busy. He has made too much money. So someone like that was not a thing of passion.
No.
And when my friend told me his area of passion, I was surprised. But I'll not mention it so that they will not start to
Yeah.
so for someone like him, I guess when he had worked for a lot of years and made so much money, and he already made himself grounded. They will call him when they meet him, and sometimes he's saying he doesn't have time. I think he decided at that point,
That's it.
that's it. I'm not going to subject myself to any form of burnout.
Yeah.
I'll just do it when I have the time, when I feel like doing it.
Yeah, so still on the burnout shit, we cannot throw it out. That's a fact. From what you just said now, it's obvious that when you have passion for it, you tend to ignore the burnout aspect. It is there, but you would not recognize and marry it. Yes, so but it's there.
Yeah.
I, you know, let's look at it generally now. Burnout is burnout. Whether you like it or yes, I know when I was a banker, high used to be as a bank, high tends as a bank. In as much as you burn out, you still have to do the job and get it done. But of course, I can begin to explain to you, describe how it's like and all of that. Your here is different, Finland. You're an immigrant here. And the nursing profession is interactive. You have to talk with your client, like you rightly said. There's this communication that has to happen every now and then with your client. And I know that from where you're coming from, English is your language, right? But Finland is not English. So in other words, there's this language barrier. I'm wondering, there's enough gone out to it. The job itself is stressful. Okay, so you get to the workplace, you need to communicate with your client. How are you doing this? How do you communicate with your client in the language that they understand? But you get it done. Like you get frustrated sometimes because you have most times to use the right words to communicate to your client. And this is not your language, as it were. How do you manage?
Yeah, good question. When I started first, I didn't have the finish going so well for me. So it was kind of a little challenging thing for me to, talk with the clients and my patients and also the doctors, because being a nurse at some point, you have to do some doctors rounds with the doctors and you have to speak the language with them to also tell them about the patients, their well-being and all whatnot. So it was a big struggle for me then. I remember my first
I like remembrance.
I remember my first workplace, they wanted me to be the head nurse there.
Okay.
And of course, I already know the responsibilities that comes with head nurse. You're supposed to talk with the clients, relatives. Like every eye and everybody is on you. So I was rejected and I told her like I don't want to do this. I'm not competent. I just prefer to be in the corner there and just work and go. Yes. So she kept on pushing. She's like, Angel, because they call me Angel here. So Angel, I know you are capable. I've seen the qualities in you to be a good nurse and, talk. And that particular period, my mom was in Finland. So I would always come back and tell her, I don't know why this woman really want me to be a nurse or to head the department, while we have other Finnish people who could. I figured, yeah, do these things. And so my mom will, she's also a Christian. She'll say, maybe God has something, think about it, blah, blah. She'll just say so many things. And I told her, and actually, my boss told me that she was going to give me time. I told her that I want to think about it. And she said, I will give you time to think about it. So, but at that particular moment where we think about, I was thinking
So
about.
sorry. So the issue there is it really competence is not the matter.
It's the language.
It's the language. Okay, right.
The language it was for me. So I'm still getting there. So So at that moment when I was processing the thing and thinking about it, so one day I came to her, I told her like, that I'm sure that you have noticed that I don't know how to speak. Well, I'm not fluent in the Finnish. Even when I speak with you, you know that I lose my words. So this is the main reason why I don't want to take up this thing, because it might somehow mess up everything, like talking to clients and their relatives and the doctor, and she told me not to worry about that, that she's going to take care of that. And there was one thing she told me first. That was when I knew, okay, no, maybe God really wants me to to start my practicing my profession. Yeah.
Yeah.
So she told me that whenever we're having doctors' rounds, that she's going to be there with me to speak with the doctor while I do all the changes and everything, because the doctor will usually, if it's medication, they will have medication changes for the patients and all those things. And then she told me that she will also go ahead to call the relatives and tell them about what we have. So the things. I'm like, wow, you'll go to that extent just for me to be the helpless. I said, okay, no problem. So if that is the case, then I don't have any problem. This is just my fear.
Okay.
So that was how I started. And from there, I started hearing until I got to get
Okay, that's
where I am today.
I know your language proficiency right now is that high, very high. The workplace culture, right? How open are nursing tailors in Finland when it comes to talking about stress and emotional exhaustion? How open?
The Finnish nurses, they are very, very open.
You guys,
They are blunt.
to yourselves, you talk about the work stress.
They are very blunt. For them, they don't hide it. They don't know how to keep back his place. They will tell you like, I mean, and for them, it's always like using the word depression.
So managers generally they recognize this fatigue with the state from you guys.
Yes.
Okay.
So you said they use the word depression. And that is one common word I've done so many times in Finland. And when I hear it, I mean, for someone coming from where from Africa, from Nigeria, depression is not a thing that just, it's not a word that we just use. We don't. So when I first came, you hear some lecturers use the word depression. And all that. What's making them depressed? I'm just because yeah, I know where I'm from, and you saying depression, and some other way it will okay, towards November, my first year, they will tell us that the dark, the month is coming, that you might get depressed. In my head, I will wonder depressed because of darkness. Gabriel scheme, I really understand what the depression meant. So what I'm trying to say is, it comes easy to them to just use that word for depression. Now the non or the immigrant nurses, they use that word depression.
I've not really like seen, apart from the ones that are almost born here,
Almost only.
meaning that they were very little.
It's okay when they came.
So so they try to, you see them exhibiting such traits as the things.
Okay.
Yeah, in that distance. So some of them will also tell you, the work is so heavy, and in my mind I'm like, what is heavy in this work? Like, I know we have this fix here that they're saying heavy. Okay, maybe they are giving them, for example, 2 patients that they have to take to the shower. And these 2, they are almost like everything they should do by themselves, but it's just for you to stand there. And for me, literally, I could take even 5 of those to shower iron. It's nothing to me.
Why are you making me feel calm?
The way they will be crying about it and all red. I'm like, oh my God, what is this? So, but I understand them. This is how they've been brought up, stress, easy life, exactly. So you don't blame them in these days because it is what it is.
Yes, it is what it is, but burnout is burnout. Whether you like it or yes, we're all human. Somehow you'll be too tired. Sorry, what's the difference between burnout and tiredness? Can you differentiate the two? Because in my head right now, I'm beginning to mix them. I don't know. When you burn out, it's different from being tired, right?
Yeah. I think when you're tired, you can still take up responsibilities and tasks. But when you have burnout, like you're done.
You don't. Okay, so have you ever experienced that?
No.
You've never.
Never.
Okay, right.
We really have to see it.
Never.
Okay, so when they experience it, how do you sense it as a head nurse?
How I sense it.
How do you sense that your colleague, your subordinate, is beginning to burn out?
I sense it because there are some people that fake it. And I know it. I see it. I recognize it.
Okay.
So because you can't tell me like, this one is a, and then you go clubbing. You see you in the club, you're posting everywhere, you are having party. Like, how are you born out?
How you burned out? I mean, there's no burn out there.
You're not burned out. So you just want to go and, live life, enjoy. You feel you're missing out from out there.
See, I remember that there are those times, sometimes I'll be so tired. I don't know if it can be called burnout. I'll be so tired at work that I just want to go and rest my head. So when I eventually leave, exhausted, I manage to find myself at home. And there is a match going on. So going on.
You will switch it.
If I switch on that TV and action start, you see me with that energy. So where is it coming from? But few minutes ago, I was really tired.
That was
That's tired.
This time there's
Not burning out.
So that's why I say the when you're tired, you can still take up tasks and responsibilities. But then when you're burned out, you're gone.
So you are able to find that out from your subordinates, and you put it to them, or you let them be. See, I'm asking this question because I remember many years back, there's this guy in my office, back in my country. He came to work, and from his look, he looked tired, and he started work. And he went straight to my boss then and said, he's tired. Can he go home? The boss was like, you barely came in what right? You tired. From what? He went back to his seat and he was working. Within 10 minutes, this guy slumped there. And he was rushed to the hospital. I'm sorry, he died.
wow.
Yeah, he died. So, at that point, my boss, his peers, he was looking tired. But from my boss' lens, he was not looking tired.
How did you feel?
Yeah. For me, I will also say that there are different types of stress. So it might not also be from work. Maybe your boss was seeing it like he just came to work, right? He has not done anything to stress himself to be tired. So maybe he has had occurrences that have stressed him mentally and made him tired. So even though he's coming to work and, your boss is just saying that he's resuming and, but then he's mentally tired. He can't coordinate whatever he's doing. And I usually tell people that is the most dangerous type of
Tiredness.
tiredness.
What?
Mental.
Mental tiredness.
Yeah. So you can see somebody that some people say I'm workaholic, and I say okay to that. I don't mind. So I can be working so much as I do now, and somebody who is sitting at home will be more malnourished, more looking haggard, more everything than me. You will think the person is the one working as I am working. Why? Because they're not mentally okay.
Yeah.
Okay. Yeah. Yeah.
But I've learned how to put all these things together. In as much as I work, I love to work. That is my own. Everybody know what they love to do. So my own area is working. I love it. I love my job. So in as much as I do that, but I still find a space to keep myself mentally sane.
Okay, can you share the sort of good
Okay.
quick thing from me?
Yes. So whenever my brain or my body tells me I need rest, I don't take back to take myself. Is it that I give myself a treat to help out myself, or I take a holidays, just something out of work. Sometimes because I'm also a mother, I have my family. Sometimes I tell my children that this is mommy's time. I don't need disturbance. I can lock myself in the room for a day. I might not be sleeping all through. I might just be on my phone and doing other things. And nobody should come and do mommy, mommy, mommy. No. This is mommy and you know it. So they respect that. So then I know, I guess I was having a discussion with somebody and I told them it's just this our body is just like a car, right? You use your car so well and you don't go for maintenance, you don't go all those things that you need to do to a car. One day it's gonna break down. So the problem is not about the workload for the car. The problem is the servicing.
The maintenance, yeah.
The etc. So it's same with the body. The problem is not about the work you do. It's about the servicing. It's about the maintenance. So you have to, everybody have their own, like how their body reacts to stress or to tiredness or to, so I have learned how to listen to my own body. So when it says I'm done,
You give it to
I give it the service it needs and then I continue.
Plus,
I don't look back.
yeah, must you have passion for the job that you're doing,
Yes.
and that makes you less prone to mental fatigue. Because I know, I would have said I think, but no, I know that you doing what you have passion for makes you happy about it, and makes you less prone to mental fatigue. Because your body might be tired, but mentally you're not tired. And sometimes your body might not be tired, but mentally you are tired. Once there is mental fatigue, especially from, because there are other factors that are challenging, maybe you're thinking about, have some challenges, some problems.
Exactly.
But
You go from family,
yeah,
relationships.
back in Nigeria, let me explain this to every other person that does not understand. I live in Lagos, and in Lagos we have the mainland and the island. So you find that many people work on the island or live on the mainland, which I did also. And some people also live on the island, work on the island. So when the work closes, to avoid traffic, those of us living on the mainland will wait. We wait until late. Maybe work closes at 5 p.m. We wait until 8 p.m., 9 p.m. sometimes. So that the traffic would have, reduced drastically. So we just drive home.
How do you wait? How do you wait?
We just stay in the office and watch the news and watch maybe the TV. Just relax. Some people wait by going to one joint to ease off. But you see some people stay in the office. They live on the island. If you check, their homes are just about 5-10 minutes away. And no matter the kind of traffic, in 30 minutes, max 1 hour, they are home. But they'll stay back. Why? Home is not a sweet place to go to.
For them.
for them. So they are tired. And mentally they are tired, but they stay from the office. And sometimes you get to work and you hear one news that from the HR department, we are sorry to announce that this and so and so person has been hospitalized, that so and so person is something happened, it's tragic, he just slumped. It's because mentally they're tired.
And then they go home to meet another tiredness.
So
They'll pile up.
and if there's work that gives you fatigue, and there are challenges from home, you are from family stuff. So it's burnout has so many factors, that contribute to it.
So in your view, in your own view, how does mental health support for nurses in Finland compared to maybe Nigeria?
Is there support actually for mental well-being for nurses?
Here in Finland.
They say it,
They say it.
that there is like
Are they?
maybe at workplaces, they have those
Counselors?
counselors there that they will tell you, okay, go and meet. If you talk about like you are mentally internal, all those things. So they have people you can actually go to.
Okay, so it's established to have them here. How compared to that of your own country? You don't know?
Did you work in a job before coming here?
I didn't go on there, but I don't think that is established because even we the Nigerians, we don't want to accept where we are now. We don't want to accept because we think like anybody that will tell you you're mentally down, you think maybe you've gone mad. You don't even want to accept that in the first place. So it starts by you accepting that you have a problem so that you seek for help. Right?
Yeah.
This is on another way. But the definition of mental health is not what you're seeing now from the ordinary Nigerian standing or the other.
Because when I was in Nigeria,
Yes.
I would normally think mental health is that you're already running mad. You can't cocoa like they should touch you before you remove your clothes. So
But that's not what it is.
that's not what it is. It's beyond that.
Or can you throw light on it so that we can really punch it?
Okay, so for me, mental health is in all directions. It can even be with the way people talk to you. You understand? If someone talks to you in a manner that is not supposed to be, it can affect your mental health.
Yeah, true.
Words contribute to that. You know, things also that maybe there would also be money factor. There can also be the stress at job that we're talking about. There can also be relationship issue. But then when I was in Nigeria, I understood mental health from the perspective that is always village people that is chasing you. Someone has done something to you, now you're about to remove your clothes and go to the loud, go to the road and run naked there. But then it's beyond that. And some people don't also understand this thing with the words. Because most people are so careless about what they say to people. You don't know their background story, you don't know what they have seen in life, and you just talk to somebody and you throw words anyhow. You feel it's a joke. But now you've really touched something in that person. Exactly.
Okay. So anything that can distort a normal human, what would I call it now? Normal way of reasoning.
Yeah.
Anything that can distort that normal reasoning
Exactly.
could be 10 mental health.
So, you said, for example, the way you talk to you, to someone. Have you had any experience, maybe not personal experience, or you witnessed or you heard who were the superior, for example, in your line of work, is talking to a subordinate using terms that they're not supposed to. Like some will say, if you don't want to do the job, go, leave the job, they go for. Or should I get someone else to do it, Abby? had of sort of experienced it?
Yeah, I've experienced it, like seen it so many times happen, that
At the workplace.
yeah, at the workplace also. So, things like, yeah, you're not competent in the work. So not the case. Yes. But there's job burnout. It can also, it's not, most times I will say it's not from the leaders, like the bosses, okay? It's from the workmates, from the team. Sometimes it's the air, it's so toxic.
So sometimes it's not spoken.
It's not spoken. Yeah, you feel it. So, and sometimes it's spoken. They don't tell you directly, but you hear those, yeah, side talks coming out from that. So, those kind of things affect people through mental health. Because if you're that kind of toxic man, you wouldn't perform well. You won't work rightly.
It helps your confidence.
Exactly. Whatever you do, you're like, they will still talk about it. So it's one thing.
Okay, so we have been dealing with coping with this mental health and the likes. What daily habits helped you in curtailing some of this stress?
I think I've talked about it. It's like how I
Can
I do myself.
like when's daily? Daily.
Oh, daily.
Yes.
Okay, the daily ones, prayers.
Prayers.
Yeah, she's a Christian mother. Yeah, so prayers a lot.
Prayers help me a lot.
Maybe you can just tie it to why annual vacation is important. You can tie it to that. What you're saying now.
Prayer.
No. I mean the daily habits.
Okay.
Yeah. You mentioned prayer, right? I know you're going to say some other things. I want you to now tie it with, because I know that vacation is one of those things that can ease your stress, right? So you can tie it to it.
Some people get stressed with vacation, right?
You see, so please don't trust.
Even on vacation, you're thinking about other things, and then you see somebody on vacation, on top of vacation, they die there. And it's out of stress. And they're on vacation. So it's not just like going on vacation. That's why I say, like, you have to understand your system, know how it works. When you are on vacation or you give yourself rest, you try as much as possible to shut down. And what helps me in shutting down, like from every noise, I love music. I'm not
What kind of music? What genre? Is it just maybe Christian?
only Christian music. So okay, secular music is okay, but that is not what gives you
Okay.
comfort.
Yeah.
If I'm cooking in my house, you see me, I put music because I don't want to also get stressed with my cooking or feel like maybe it's so much more care or So I will always tell my son, they know me. They put music immediately. I enter the kitchen, they go and put music.
Okay, so that's another way.
So music is my number one, in fact, to go to. So I used to ease off. And when I take those breaks, I make sure that I also like listen to music a lot. Then secondly, I pray.
Okay.
Social vacations. I've seen some of. I know you go on vacations. I know you do. And sometimes in a year you've been to here, you've been to there. Agent is enjoying coming. So would you say for someone who is working, who is comfortable in working, meaning that at least they had the taking of their basic needs, they had regular jobs. Would you say vacation is important and necessary for them?
It's very important. And when you go on vacation, let it just really be vacation. You don't have to combine business and vacation. No.
Okay.
So you shouldn't go with your laptop in case of emails coming in.
You shut out from the
No,
work.
that's what I said. Make sure you shut down.
Shut down like the fridge, the way things shut down in July.
Exactly. You can never call them for emergency that we're lacking staff that they will listen to. In fact, the phone won't even go through.
And so do you think that is healthy for the healthcare sector and the individual?
For me, I think it's perfect.
It's perfect.
Because they've been working for so many months, and now the summer that they don't really have so much comes, and that's why once it's July, you call, you send emails, you there. They just so for you out there, if you don't know, in Finland, once it's July, don't send emails.
Okay.
Send emails.
Yeah, so as we begin to wind down, I want to ask this very important question, and this is to our new nurses, immigrants, particularly. If you were to advise them, what practical steps do you think they should begin to adapt to in their place of work for the first 1 year? Just to ensure that they guide jealously their mental health.
Number one is I tell almost everybody that I mentor, I say, number one thing in life is just know what you want. Okay? It's like a ladder board to you stepping forward. I've had so many students that I was the supervisor. Yeah. But then there was one that stood out, with me those days because she's also like Africa. So we have a vibe, we talk. And then she will come every time. She'll already be stressed about like what this person is doing, this Plymouth person is doing. Look at what they're doing. They will do this for rules. Why you're not cooking? You're a leader. You should. And then at some point, I started telling myself, this girl is trying to put all her stories now on me because now you're making me to see things that I'm not
saying.
that I don't even want, I don't care about.
Yeah.
So I called her one day. I told her, number one, why have you come to work? Why are you here? She said, yeah, I want to be a business, I want to make money, and then I said, I want to concentrate on this artist. Why don't you hit this goal? Yes, they're really stressing you. You come every day, you talk about how many showers they are giving you, and they are just taking one. And I said, just come, do your job.
Focus.
Focus.
Yeah, focus.
It's just simple. You don't have to think because if you really know this is your calling, that you're not just here to please anybody. Because for me, what I do for the goose, I do for the gander. I don't say because this person is finished, let me give you a preferential treatment, and then because you're African, okay, now go. I'm not. No, if I want to help out, I help like everybody. It's even, okay. So when I come to work, I just want to do my thing. I don't want to do like if you don't want to do the job that is assigned to you, it's left for you. It's not my business to start saying, because you've not done your own, let me down. Okay, why should you not be doing that? It's me stressing myself.
Yeah, that's true.
But because now I know this is what I love doing. This is my thing. I'm doing it, but it's two-way thing that you don't allow in as much as you want to do what you love doing, but then you don't allow people to ride on you, right? Because there are people that want to take advantage of it that, okay, because now this one can accept anything, you can do anything, then they want to pack the load on you. No, I made them to understand that in as much as I'm open to anything, but then don't make me look stupid or silly. I know what I'm doing. So I make them to understand that, the differences. So I told that lady, I told her, please, when you come to work, at the beginning of your shift, just know that this is what you want. I have come here to achieve so thing. Do it. Just don't mind whoever that is doing what and whoever that is not doing anything. The list they have given to you that you should work with. If there is shower in it, go to the shower and just forget about who did not do their own and who did not.
For some of us that don't know what shower is, okay, what is shower? Because shower, from what I know, is to go to the bathroom and bathe.
Yeah, and bathe. Yeah,
That's the same thing.
yeah, it's the same. Okay, so it's going to
The patient can't.
to go to the shower. And he calls
The patient.
Yeah, you call the patient. If it's in the hospital, and if it's in the old people's home, you call them residents.
Yeah, so okay, I heard somebody mention it.
Clients are the ones that are in their home. Okay, cool. But then the ones that are in the old people's home, residents. They're the ones in their home, clients, and hospital patients. So it depends on the
I'll write that one now.
on the place where you find yourself. Yeah. So I would say as we're concluding, I will just also add this because at the moment I'm running my masters
Yeah.
to be
Okay, that means to be specific.
an advanced nurse. And what that means is that we are almost like the doctor, right? So we do almost everything that the doctor does apart from doing surgeries. And of course, some doctors don't do surgeries unless it's their area of specialty. So it's not been easy, I would say. But then while growing up, I've always wanted to be a doctor. I have seen my mom. My mom is a retired nurse. Okay. So those days I would be with her. She worked so well. People knew her. Like any little case you have, they will say, have you gone to, because people call her Momifi. Have you gone to Momifi? And for her, she combines religion to, okay, let me not say religion because religion is another thing. So she combines prayers, Christian faith, with medicine.
Yeah.
So you call, she's going to pray for you before she start any treatment.
Even if you don't want to accept the prayer, or
Yeah, because she would ask you, and I've never seen anybody who does not.
she seeks for permission.
Yeah, she seeks for permission from people, and then she wants to talk to you even about Christ if you're not a believer. And then, yeah. So I've also seen her most times because her area of specialty is the pediatrics. So I've also seen situations where people come emergency times at night to the house, and she in the process of treating or giving the right level comes and they give birth there, and she brings forth the child at home. Yeah.
In Nigeria.
She's that good in Nigeria. Yes, in Nigeria. She's that good.
I'm on. Yeah.
Yeah. Yeah.
From your experience now here in Finland, do you think that kind of delivery is medically sound?
Is it permitted in Finland?
It can be permitted if, okay, in Finland, I've never heard, but in US, I've seen people do home deliveries.
Yeah. So what I'm saying is this: from your experience here, you've gone through the work tools, right? So I'm asking, because that is a case of emergency. It just happened, right? So do you think it's hygienic? I think that's
Yes, if you have the the right tools for it. If you have the right tools for it, so it's hygienic.
okay.
So from what I see her do, that was where the interest came. So I'm like, I want to be a doctor so that my mom will come to be a nurse in my hospital.
Okay, that was your dream. Now then.
My little girl idea those days, I'll be like, I'll be a doctor so that you can come and work. You're so good at what you do. Like, sometimes you don't even have to think about your treatment procedures. You just go out and dish it out at President here. I said, I would like to have you as a matron in my hospital, so then you can teach my other nurses and
How to do it.
that probably others. She's going to get older when I get to that stage.
Yeah.
So, but it's contributed to my drive. I really pursued like that drive and hunger in me. But we have something called JAMB in Nigeria. So for the audience who are listening, so the JAMB is what gives you admission into the higher institution to study whatever discipline that you want. So that particular examination messed up with me. I wrote
It was just jamming on
I'm telling you, I wrote it like 5 good times.
Wow.
And some of them got seized. Some of them, like, okay, the cutoff was not up to what you needed for studying medicine. And it was like that. Frustration about it to set in. My mom kept talking to me like, okay, calm down. I remember one particular one. I would never forget that. They said all the best results was seized that year. And then you need to go pay them over there, the high people, so that you can get your results. And because I come from the Christian background, my parents are like, no,
We're not gonna pay.
but I think that if God knows that is what should be yours, they have to release it. But unfortunately, it didn't release. So that was the one that shocked me. I'm like, God, this is my result. I know my heart. So I'm like, okay, I'm done. I'm not going to university again. My mom kept talking. So somebody now introduced me to one, they call it pre-science.
Yeah.
From Nabes University. So I thought about doing that. And, the long story short, I finished that and then found myself in another discipline, food science and technology. I finished that one and then got into the working field, got married, then it's Finland. Then I still had that medicine, I asked about it. They said you have to speak Finnish to be in the school. I'm like, oh, not again. This school really don't want me to do this. And they said, okay, there is nursing, and it's English. I'm like, okay, since it's healthcare, maybe I can find a way around it. See. So, but because I came with another course to Finland, I had to finish that one, then got into nursing. Then after studies and after 5 years, or almost more than 5 years of work experience, then I heard about this course. I'm like,
Advanced nursing.
yes. And when they explained it and it's gearing towards what I have in mind,
Wow.
I had to enroll for that and started that. I will say that it's not been easy, but what has kept me going is the drive. It's, because I know what I want and where I am heading to. Now, if you remember, I said this medicine thing, it's been back when I was a kid. So it kept on going with me. And that's why I don't want to, I've met so many challenges in the course of my studies now. Because I have my family, I have 3 children.
Yeah.
And at the moment, my husband does not stay with us because work calls. So he has to move, to someplace else. Yeah. So it's not been really easy with me, with studies, with kids, and with work.
Was that a thick skin? So,
So that momentum was the drive,
Yes, exactly.
the passion for the job.
so yeah, we're gonna take it home now. Like you said, what you do, what is good for the Jews is good for Ugandans. Yeah, so So if you do anything nice for the Jews, do it also for the Ugandans. Yes, exactly. Yeah. So now the last question for just a few seconds. What's that phrase, that proverb, or that thing that we were told, well, over time as a young child and a young person, that has been a drive or a pushing force for you that you still use
Up to be.
up to date?
It's you are a masterpiece.
You are a masterpiece. So that she's going for masters. Wow, masterpiece.
Yes.
You could normally say that you're more pure than you are a masterpiece, and indeed you are. You're really a masterpiece, specially designed by Co.
Yes.
Yeah, so you can see now today you are displaying that attribute, a masterpiece. That is to say, we always say, the tomorrow you talked about yesterday is the today.
Yeah.
Yeah. So you can say after how many years? The so and so year you've been talking about is this year.
Exactly.
And for our viewers, yeah, she's young and beautiful, but she has 4 boys, right? 4 of them.
I have 3.
Sorry, 3 boys, hefty boys. 3 hefty boys. Yeah. Actually, thick skin, right? Yes. Thank you so much for coming to being a guest. It's been wonderful.
It's been a pleasure.
Once again, this is the Global Reach podcast, and it has been a wonderful episode. And this was brought to you by the Global Reach Studios. And I remain your host, Donald, and my co-host also, Vamos, yes. And stay tuned, subscribe, and you get some.
Always punch that. No. Punch it.
You can like it also.
Yes.
Thank you so much.
Thank
See
you.
you next episode.